One of the things that people tend to say about the health service is too many managers, just get rid of the bureaucrats. But of course, life's not as simple as that. NHS managers do complicated and important jobs. The work that they do and the decisions that they take directly affect patient outcomes, which is NHS speak for whether patients live or die. Sharon Charity was until very recently a senior NHS manager, and now she runs her own independent PR consultancy. Tell us what it's like to be an NHS manager.
As a manager, you're operating under a constant, very hostile media spotlight. That's the first thing. And then linked to that, there's the fact that health is probably the hottest political potato in this country, and as such, and quite properly, the NHS and people who manage in it operate under intense political scrutiny.
So how do you measure the performance of NHS managers? Is it fair to compare them to their colleagues in the private sector? Professor Carol Proper of the Centre for Market and Public Organisation at Bristol University has been trying to find out.
Some colleagues of mine at the LSE and I did some work looking at management quality and management practices in NHS hospitals in England. What they found was that there was a very wide variation in the performance of hospitals in the NHS. So there are some that appear to have quite modern and good management practices, and some that appear to have rather less good management practices. We also looked at how those management practices compared with the average UK manufacturing firm, and we found, somewhat I suppose to many people's surprise, was that the average UK manufacturing firm appears to have better quality management practices than does the NHS. Now, we don't know why that's so. It may be that it's actually very difficult to manage a large public sector hospital, but nevertheless, that's the facts that were found. We looked at the relationship between management practices and the quality of output in NHS hospitals. We were interested to see whether a tool that was used to measure the quality of management in firms and used internationally could also predict good outcomes in the NHS, in a hospital setting. And what we found was, when we looked at a battery of measures that measure whether a hospital is good or bad, we found that hospitals which had better financial performance, lower waiting times, more satisfied staff, a higher healthcare commission rating, and lower death rates following emergency heart attack patients coming into a hospital, we found that better management was positively associated with more positive quality outcomes.
Some of the best leaders and managers I've ever worked with and for are people I've met in the NHS. Very, very many of them have come from clinical backgrounds. They retain their registration as nurses, therapists, doctors and whatever. And lots of them also provide hands-on care at the same time as sort of being team leaders, supervisors, matrons and so on.
Well, what we did next was we then asked, is competition associated with better management practices? What is it that drives up these management practices? And the reason we were focused on competition is there's a large literature for the rest of the economy that shows that firms that are located in competitive industries do better. And one of the ways they do better is by having better management. So what we wanted to know was, does the same process happen in hospitals? Or are hospitals essentially kind of hermetically sealed and aren't affected by market forces at all? So we were interested in the relationship between competition, as defined by the number of hospitals around any one hospital, the number of hospitals in a local area, and management practices, and asked the question, if you've got more competition, do you have better management practices?
In order to answer that question, The researchers made use of an interesting political fact, which is that politically marginal constituencies have more hospitals than others. The reason being that nobody wants to close down the local hospital if you're very close to being defeated by the rival candidate. Consequently, politically marginal constituencies have more hospitals than elsewhere, and that gives you something to study.
So what we drew from that was that there appears to be, as in the rest of the economy, an association between better quality management and better outcomes, and some of that may be due to competition.